Good morning, everybody, and welcome. My name is Paul Holden, President and CEO of the Burnaby Board of Trade, and welcome to today's event. Before we start, I'd like to take a moment to recognise that we're on the traditional homeland of the Hunkaminam and Skohomish-speaking peoples, and to extend appreciation for the opportunity to hold a meeting on this territory. Several weeks ago, new powers were granted to public health officials to issue 10-day closure orders to businesses which had COVID cases amongst employees and transmission in the workplace. And since then, nearly 20 Burnaby businesses have been issued these closure orders. So today's session with WorkSafeBC is designed to provide the very latest information and best practices for operating safely during the pandemic, and to make sure that your safety plans are up to date on what is required to keep your employees safe. Hopefully, once you're armed with this information, you and your businesses can operate safely and not face receiving one of these 10-day closure orders, which obviously is extremely damaging to the business. So this event is part of our business resilience programming, which is offered by the Centre for Burnaby Business Recovery and Resilience. This centre was established as a result of our task force for business recovery and resilience, which was conducted in April and May last year. And it's really the hub for COVID-19 supports and economic development activities to help support the recovery of our economy and of our community. We're very pleased that the Centre has been sponsored by a number of organisations which help make its work possible. Those organisations include, at the platinum level, we have Simon Fraser University, Douglas College, BCIT School of Business and Media. At the gold level, we have Electronic Arts and the TD Bank Group. And at the silver level, we have Pacific Blue Cross, Fortis BC, and Hemlock Printers. So thank you very much to those organisations who are supporting this work to help the Centre for Recovery provide the resources that businesses need right now. And as always, I'd like to thank our annual partners, a great group of organisations who stand out as top corporate citizens here in Burnaby and support our work throughout the year. And I think you can see their logos on the screen right now. So normally at this point where we thank our sponsors, there's rapturous applause from everybody. So we'll assume you're rapturously applauding virtually. I'd like to introduce our speaker now, so we're going to get underway with the session. As we go through today's presentation, the presentation is being recorded, if you have questions, please enter those in the Q&A section at the bottom of your screen, and we'll have a few minutes at the end of today's session to answer those questions. So I'm pleased to be joined by Chris Back, who is the Director of OHS Consultation and Education Services at WorkSafeBC. OHS Consultation and Education Services serves the workers and employers of BC by positively influencing health and safety behaviours and disability management practices through partnerships, consultation and outreach. Chris has been with WorkSafeBC for 6 years in a number of positions, and prior to WorkSafe, Chris held various leadership positions in health and safety and disability management, primarily in the healthcare sector. So Chris, good to see you again. It's been a few months since we were last together, so I'll turn it over to you for the presentation.
Yeah, thank you very much, Paul, and thanks to you and the Burnaby Board of Trade for having me here today. So good morning, everyone. We've got about probably about 30 or so minutes worth of slides that I want to run through, and then we'll open it up for some question and conversation after that. First of all, though, I would also like to acknowledge that I live, work, and play on the traditional, ancestral, and unceded territories of the Coast Salish peoples, including the Musqueam, Tsleil-Waututh, and Tsawwassen peoples. So thanks again for having me here today. I'm just going to share my screen and bring up a few slides, so bear with me for a sec. Okay, so hopefully you can see that. If not, maybe Paul, let me know. So we're here to talk about workplace health and safety and COVID-19. And as mentioned, I was with you back in June, I think, of last year, doing a presentation that spoke specifically to the development of a COVID safety plan. We've come a long ways since then. Obviously, the COVID safety plan is still a requirement. And I am going to speak a little bit about that plan today, but I'm not going to focus there. I'm mostly, actually, move on to the next slide here. I'm mostly going to get into points, I guess, 4, 5, and 6 really on the agenda. So I will talk a little bit about the public health orders. I'll talk a little bit about COVID safety plan, industry specific information, but then start to get into some of the focus areas and some of the information that we're finding as we get out there and do our inspections, write our orders within industry, and some of the pieces that we're starting to pick up on where employers are struggling, if I can put it that way, with keeping their COVID safety plan up to date. And hopefully that will be some useful information for you as we go forward. So a little bit on the public health orders to begin with. You know, I think it's important for everyone to continue to stay up to date on the orders that are applicable to your industry. If you just go onto Google, type in PHO orders, it'll take you right to the page that has all the orders listed in chronological order based on the date that they were issued. I'm sure all of you are very familiar with that. There's some general orders, of course, that apply to all workplaces. And then there are some orders that are specific to certain industries, which I'll talk about in a moment. So it's important that you as an employer stay up to date on those orders, as well as the notice and the guidance that go along with that from the provincial health officer. Outside of that, it really does come down to the basics of physical distancing. You know, again, 2 meters of distancing. We'll talk a lot about that today. Cleaning and disinfecting and personal hygiene. And when we talk about personal hygiene, we're talking about covering your mouth and your nose with a disposable tissue or the crease of your elbow when you sneeze or cough, washing your hands with soap and water for at least 20 seconds. So we do know that using soap and water is the single most effective way of reducing the spread of the infection. However, if you don't have soap and water, you can use an alcohol-based hand rub or and otherwise known as a hand sanitizer in order to disinfect your hands. But it's important that your hands are clean before you do that. They don't have any visible soil on them. So if you work in an industry, construction industry, for example, and you've got dirt and grime all over your hands, or if you work in as an auto mechanic and you've got grease on your hands, or work in the food and restaurant industry and have food on your hands, you do need to wipe off that visible soil as best as you can before you're using any sort of hand sanitizer, for that sanitizer to have its disinfectant properties work best. So, and that the same goes for surfaces as well. If you're cleaning a countertop, disinfecting a countertop, you would want to wipe any dust or dirt or grime off of that countertop before using any disinfectant. Also, not touching your face, your eyes, your nose, your mouth with any unwashed hands, and not sharing food, drink, utensils, or other things in the workplace. Again, I think these things are fairly familiar at this point in time for employers. Then we get into some of the orders. And the first one I want to talk about is the workplace safety order. This is an order that has a number of requirements within it. The first is reviewing your COVID safety plan, so ensuring that that plan is being kept up to date based on changing conditions. We'll talk a bit more about that as we go forward. Ensuring that workers are prohibited from entering the workplace if they are unable to pass that health check, and that's getting into those typical questions around signs and symptoms related to COVID, whether they've been out of the country in the last 14 days, whether they've been told by public health to self-isolate. Encouraging workers to work from their homes where possible. We know that this isn't possible for all workplaces, but where you do have the ability for your workers to be working from home, then it is strongly encouraged that that occur, and that's outlined within this order. And then also including measures that would prevent workers from congregating within the workplace. And this is a main component of the COVID safety plan. But what we're finding as we get out there and talk more to employers is, for the most part, related to the job tasks. The protocols are well laid out, but where we're seeing some challenges is those non-job task related areas within the workplace where workers may congregate. So elevators, lobbies, hallways, stairwells, corridors, break rooms, bathrooms, things like that, that your plan really should cover off those areas of the workplace as well, to ensure that your workers are not congregating in those areas in a way that can't allow them to stay physically distanced as appropriate. So something to think about within your COVID safety plan. Now, within the COVID safety order, or within the workplace safety order, there's also the worker health check. And just to sort of mention the worker health check, this is a requirement. All employers do need to ensure that their workers are completing a daily health check if they are coming into the workplace. If your workers are working from home, they don't have to do that daily health check, because they're not exposing themselves to any risks within the workplace, so to speak. But if you have workers coming into your place of employment, into your business location, your business work environment, throughout the day, then they need to be completing that health check. It is a mandatory self-assessment that all workers do need to conduct. How that occurs has some flexibility. And that's going to be dependent on you as an employer and what's feasible for you. If you're a small office setting of, say, 10 workers who come in through the front door on a daily basis, as the manager or employer, you may be able to do that verbally and just check with them as they're coming in. Or you might be able to have a little sort of sign-in sheet, so to speak, that has the questions up at the top and they're signing their name on it as they walk in the door. But that's not necessarily practical for an employer of hundreds or thousands of workers, or for employers that have their workers spread out across many work sites throughout the day. So you may need to look at other options like an online form, and there are some online forms out there that can be used, or possibly an email that is sent in on a daily basis into a general mailbox for that daily health check. So something to think about. There's lots of options on how you can do that as an employer, but you need to ensure that they do occur. Mandatory masks in public places. So the ministerial order through the Minister of Public Health and Solicitor General does have a requirement for masks within many public indoor settings as well as all retail stores. We know there are exemptions. Those exemptions are listed there on the slide. So even though it may not be a requirement within the workplace, it really does end up becoming a key component of the COVID safety plan. And as employers, many employers would likely still have a requirement within that COVID safety plan of wearing masks within public areas, again, the hallways or the lunchrooms or areas where people might congregate. As I mentioned a little bit earlier, there are some orders that are specific to certain industries. We have them listed there. So if you work within any of those industries, you'll want to make sure you're very familiar with the orders that are up on the PHO website relative to those industries, to take into account anything else that may be specific to your industry. Of course, restaurants is the one that's been getting a lot of media lately, that there's no in-place dining or in dining allowed within an inside setting. Obviously out on patios is allowed. There is new guidance actually that has just come out from the PHO related to what those patios, what it means to have those patios open, and any covers or tents that you might have outside are addressed within there. So if you work within restaurants and you have a patio setting, I would encourage you to become familiar with that as well. Now, this is the big one, and this is the one where we may get some questions coming up at the end, and happy to address them. And this is the expedited workplace closure order that was just issued on April 8th. And essentially what this does is this delegates authority to WorkSafeBC to be able to issue closure orders to businesses. Now, the important piece here, the real important piece, and where we've been getting lots of questions, is around what is the criteria for that, and how is WorkSafeBC making the decision on which businesses to close. So the first thing there is WorkSafeBC isn't making that decision at all. Those decisions all come from the medical health officer or the environmental health officer of the health authority. So in your case, Fraser Health. So the Fraser Health medical health officer would be the group that would be making that decision. Once they've made that decision, they then have the option, they don't have to, they have the option of delegating the authority to issue that order to WorkSafeBC. And most of that is based on the capacity within the whole system. We have 300 officers that can get out there and help with this situation, but it is not our decision. It's not WorkSafeBC's decision on whether or not the business is going to close down. That comes from the health authority and the medical health officer. Now, our understanding is that they are following the sort of general guidance around 3 or more workers within the workplace that have had COVID-19 or have COVID-19. In the case of complex workplaces like large construction sites, the closure may be confined to a certain area of that construction site, depending on how the transmission has occurred, where the transmission has occurred, and that public interest will also be taken into account on whether or not that business will be shut down. So examples like healthcare facilities or grocery stores, schools, other examples have come up where it may not be in the public interest to close down that business, and therefore other measures may need to be put in place. Now, if the medical health officer requests WorkSafeBC to issue the closure order, then essentially 3 things occur. We have 3 responsibilities related to that piece. And the first is that we will issue that order. So we will physically go out to that workplace, and we will issue the closure order to that business. Now, obviously, there are things that maybe need to be taken into account. So the timing of when that order occurs, that's going to depend a little bit on the business. At the end of that business day or the start of the next business day, or where there might be safety issues to keep in mind. There may be some staff that can stay behind in order to deal with those safety issues, such as shutting down machinery. You think about a big pulp and paper mill. You can't necessarily shut down a big pulp and paper mill in one day. So it might require some additional staff to be able to assist with that from a safety perspective. So that's all taken into account when our WorkSafeBC officer comes out. The second piece is that the employer will be asked and encouraged to review their COVID safety plan during that closure and update their COVID safety plan as necessary. And then the third, once the workplace has reopened, within a few days of reopening, a prevention officer will conduct a COVID inspection and will do a review of the COVID safety plan. So that's essentially WorkSafeBC's role in this process. There's a couple links at the bottom of the slide there, and this slide deck can be shared with everyone afterwards. And those links are live, and it takes you to a little bit more information that's on our website related to the closure orders specifically. And if anyone has any questions on them, throw them in the Q&A and we will address those afterwards. So let's get a little bit into controlling risks. I do want to talk about the COVID safety plan really briefly. Again, most of you at this point should be very familiar with the COVID safety plan. We've issued a template on putting together that COVID safety plan that has 6 steps within it. You don't have to use our template, but I should tell you that if an officer comes out and does an inspection in your workplace, they are going to expect that you've gone through these 6 steps. So it is something to keep in mind. Really quickly, the first is assessing the risk of your workplace. That is looking for areas where people may congregate, looking for areas where you may not be able to maintain 2 meters of distancing and what you might be able to put in place as a result of that. So step 1 is really about doing that assessment, all areas of your workplace and where there could be a risk associated with transmission within the workplace. The second step is implementing the measures to reduce the risk. So going through your hierarchy of controls, which I'm going to talk about in a moment, your hierarchy of controls around keeping people physically distanced, barriers, other administrative controls, and so forth. So putting control measures in place to reduce that risk. Step 3 is about having policies and procedures in place. So ensuring that you have a policy around the daily health check, that you have a policy for public not coming into the workplace if they are demonstrating any signs or symptoms or have been out of the country in the last 14 days or have been told by public health to self-isolate. Policies in place around hygiene protocols for your staff. Policies in place around how many people can be within the lunchroom at one time. So occupancy limits and things like that. So ensuring that you have those policies in place, documented to be able to back up the plan that you have created and the control measures that you have for your workplace. Step 4 is developing communication plans. You need to ensure that all of your workers are aware of the COVID safety plan, that they're trained on any new protocols that might be put in place, for example, around cleaning and hygiene. What do the cleaning protocols look like? How do they differ from before? And are the people that are responsible for that cleaning trained appropriately on using the chemicals or the disinfectants or the procedures that have been put in place? Supervision also plays into that as well, ensuring that you have good supervision in place. Step 5 is key, and it's really key at this point in time, that it's not about developing your COVID safety plan and just putting it on a shelf and having people go and read it every once in a while. It is about keeping that plan up to date. So step 5 is really around that plan, do, check, act approach, that continuous improvement process of monitoring the workplace, seeing what's working, what's not working, getting feedback from your staff, keeping your plan up to date. And this, particularly for those employers that have outdoor working environments, the weather plays a big factor in this. Obviously we're coming out of the winter, so things are getting a little easier for people to congregate outside, but you think about that winter weather where during break time, if people are exposed to the elements, they want to get out of those elements during the breaks, and they would congregate maybe in a work truck or in a small tent or in a trailer or whatever it might be to be able to eat their lunch. Well, that might not work in those situations. And so, you need to think about the changing work environment and how that might impact your plan. Now, as I said, we're coming into the warmer weather, but how does that warmer weather then impact your plan around ventilation, keeping windows open, doors open, things like that, air conditioning, all of that sort of stuff would be examples of where you'd want to consider how your plan might change as a result of the changing working conditions. Step 6 is a little outside of the context of COVID specifically, but it's still an important step. And it's really ensuring that you are continuing to keep your eye on the ball of those health and safety issues outside of COVID. There's still lots of health and safety issues out there that will cause injury, serious injury, disease, death, and you as an employer need to be paying attention to that. If you're a roofing company, a residential roofing company, yes, you want to make sure that you have your COVID safety plan in place, but you also need to still make sure that your workers have fall protection in place when they're up on top of the roof. So, those risks are still apparent and still resulting in serious situations. So you need to keep your eye on the ball related to that as well. Now, a couple comments just related to the plan. Involving your workers is one thing that I really want to emphasize, and I'll emphasize it in every presentation I do. There's a lot of fear coming back into the workplace. Important for employers to be involving your workers. Now, there's already language within the regulation and the act around joint committees or worker health and safety representatives, or if you have fewer than 10 workers, you are still required to somehow have involvement with your workers related to health and safety. But now more than ever, involvement of your workers is important, and ensuring that you're having that conversation with your joint committee or your worker rep or your workforce in general around the COVID safety plan that you are developing and putting in place, getting their ideas as you're doing that risk assessment, their ideas around control measures, and involving them will go a long ways in allaying the fear that many workers have in coming into the workplace and potentially exposing themselves to the disease. They may have underlying health conditions. They may be caring for an elderly parent. Whatever the case may be, everyone's situation is different. So involving your workers in the conversation is really important. We then talk about the hierarchy of controls, which, I'm not going to spend a lot of time here. I think, I went over this in the presentation back in June of last year. Fairly familiar, I think, for most folks. Those control measures at the top of the reverse pyramid are more effective than those at the bottom. So we talk about elimination as the most effective in the context of COVID. That is maintaining 2 meters of distancing. So how can you reschedule tasks? How can you maybe have work at home arrangements, establishing occupancy limits? What can you do to keep people 2 meters apart from each other in the workplace? And that is going to eliminate the majority of the risk associated with COVID. Engineering controls. So if you are unable to keep people 2 meters apart from each other, what else can you do? And for engineering controls, we mostly talk about barriers in this situation. So plexiglass barriers or other barriers that will stop the droplets coming out of your nose and mouth from transmitting across to another individual. Best example, of course, is in a grocery store where you see the plexiglass barriers at the checkout that stop those droplets coming from the individuals that are in that environment. Administrative controls are less effective, as you see by the hierarchy. Still important to have in place. And the reason they're less effective is because they rely on the behaviors of individuals. And really the only behaviors you can control are your own. You can't control the behaviors of others. But administrative controls are going to be those rules and guidelines, the policies, the procedures that you have in place to say, okay, workers need to be washing their hands after before and after they have their break or before and after their shift. Or you go into a grocery store and you see the arrows going up and down the aisles to create flow for people. That would be a good administrative control. But how many times have you been in a grocery store and you're doing the best you can to follow those rules and someone walks against those arrows down the aisle in the opposite direction? You can't control the behaviors of other people. This is why these are less effective controls, but still important controls to have in place. And then the last one there is around PPE, personal protective equipment. And in the context of COVID, we're really talking about masks. It is the lowest form of protection. We know that masks are not the be-all and end-all to protecting us from COVID-19, but still an important control measure to have in place. It shouldn't be the only control measure. It should be one of many control measures. You want to be focusing on all areas of this hierarchy, but masks is an important aspect of the COVID safety plan, even though it is not going to provide full protection for this particular risk. We've got some templates on our website, not only for developing a COVID safety plan, but also for reviewing your COVID safety plan. We also have an app that allows you to have your COVID safety plan in a mobile format that's easy to share with your workers and others if needed. So I encourage you to take a look at those and utilize those templates we have. Again, you don't require to use them, but we do encourage you to at least go through that, that template process to ensure that you're covering all 6 of those steps. We then talk about workers. We talk about workers from the perspective of their responsibilities, but also their rights. So we talk about the workers' responsibilities that are just as important, and there's requirements under the Act and the regulation about workers' responsibilities related to health and safety. In the context of COVID, knowing when not to come into work. So being truthful about the signs and symptoms, being truthful about whether they've been out of the country, so on and so forth. If they are in the workplace, following the prevention measures that you have in place as the employer, there is a requirement, there's a responsibility for workers to do that, complying with the employer's instructions around minimizing exposure, practicing physical distancing, cleaning and disinfecting, personal hygiene, so on and so forth. But there's also rights. Workers do have rights related to health and safety, and there's 3 main rights. There's the right to know about hazards in the workplace, there's the right to participate in health and safety activities, and there's the right to refuse unsafe work. Those first 2 around the right to know and the right to participate are really covered under your involvement of workers in this process. Your involvement and your communication plan for workers will cover those first 2 rights. The third one around refusal of unsafe work, that one is important for you to understand as an employer what the protocols are related to refusal of unsafe work. If a worker comes forward and believes that you have not put the right control measures in place for their safety related to COVID, they do have a right to refuse that work. However, that doesn't mean that anything necessarily has to change, but what it does mean is you as the employer have to go through an investigation process and look into their concerns, jointly have that conversation, investigate the situation with the workers involved, and hopefully come to resolution. It's very clearly laid out in the Act and the regulations, so I do encourage you to become familiar with that in case any of your workers, excuse me, do come forward with a refusal of unsafe work. Pardon me, I'm just going to get a drink of water here. Okay, so moving on, industry-specific protocols. I'm not going to go through all of these. I encourage you all to take a look at our website, go to our main page, you'll see this banner. Click on that banner, it's going to take you to industries. It's going to take you to lots of information related to COVID, but one of those sections is industry-specific information. These are just some examples. We have broken it down probably to about 30 or so different industry groupings. I just pulled out some that I thought might be applicable to the businesses that we have on the line today. I do encourage you to take a look. If you go on there and you don't find your industry specifically, think about what your industry might be similar to. What we've tried to do is we've tried to create this in a way, there's under our structure, there's 550 different industry groupings under classification units in this province. We would not be able to develop protocols for all of them, but there's a lot of similarity between them. So have a look. These are not requirements. Under those protocols, they are meant to be protocols and guidance for you as an employer to help you put together your plan. They're not requirements. It is a requirement to have the COVID safety plan in place, but these protocols are meant to be thought starters for you in developing that plan and hopefully guide you along the way. We've also got a lot of other resources on our website. They're all linked here. So again, you'll have access to those when you get the slide deck afterwards. On how to design effective barriers. There's hand washing posters you can use, entry checks for visitors, lots of resources that we have on our website that you can utilize. We do encourage you to go to our website regularly. There are regular updates and announcements as the orders change at the Provincial Health Office. We update the information on our website. We're also sort of continuously adding information to our website. It can be overwhelming. But our search function is fairly good. If you go into the COVID page, type in your search of what you might be looking for, whether it's industry-based or resource-based, then hopefully you can find what you're looking for. If not, you can definitely give us a call. And I've got a slide on that on how you can call us coming up a little bit later. Some focus areas. So again, a few things that I think are really important for employers to understand. Worker abuse, we're seeing this. You've seen it in the news, so this shouldn't be a surprise to anyone, particularly in restaurants, hotels, retail establishments, and other businesses that have front-facing employers, workers that have exposure to the general public. And we've heard about the anti-maskers. We've heard about those that don't want to follow the rules, and what that has led to in certain situations that have gotten into the media, social media, whatever it might be. That is a real risk. And if you are in that situation as an employer where you have your workers exposed to the general public, you really should ensure that you have a violence prevention program in place and that your workers have been trained on what to do if those situations arise. Information is available on our website related to that, so I encourage you to take a look. Mental health, talked about this a little bit already with the fear of workers coming back into the workplace and the impact that COVID might have on them as individuals or their families, depending on the particular situation. The triggers for mental health are different for everyone. So it's really important that employers are focusing just as much on the psychological health of their workers as they are on the physical health. We've got a couple resources, the first two links there, a guide for workers and a guide for employers around addressing mental health related to COVID-19. There's also a number of other links that we've put on here to outside organizations that have great resources related to mental health in the context of COVID, posters, toolbox talks, videos that you can share, and other resources. There's lots of resources out there. Important as an employer that you're focusing on mental health as well. Working from home. So, you know, again, we've talked about working from home. If you have any workers from working from home, it's really important that you understand as an employer that your responsibilities still exist. That home environment becomes the workplace for that worker, and you need to ensure their safety. You need to put protocols in place around their health and safety in the home environment. So having a policy is really important. I've listed a number of different things here that should be within that policy. So doing a hazard and risk assessment. It doesn't mean you as the employer need to go out to the person's home. There's probably some privacy issues there, but we have checklists available on our website that will help a worker go through an at-home risk assessment, and then you can talk to them about it over the phone or over Skype or Zoom afterwards and do your due diligence. Emergency situations. I mean, obviously, you've got fire, other medical emergencies. What's going to be the situation, the evacuation procedure for that worker if that was to occur? And then check-in procedures throughout the day. If your worker's at home on their own for the entire shift, there should be check-in procedures with you as the employer. We've got some resources on our website related to working from home that would likely be very helpful for you related to COVID, including those checklists. And then we have a great resource around computer workstations. And really outside of those emergency situations, ergonomics becomes your biggest risk for your workers. Musculoskeletal injuries related to sitting in front of a computer all day long. A great resource linked at the bottom of this slide, how to make your computer workstation fit you. Easy for an employer and a worker to read through on how to best set up a computer workstation in the home environment. I do also draw your attention to the one note in the middle there around breaks and micropauses. It's very easy. I'm guilty of this myself, rolling out of bed, having a bite to eat, getting in front of the computer and not coming up for a breath until lunch or dinner. It's not healthy or safe for any of us. So we like to encourage the 20-20-20 rule that every 20 minutes, you're standing up for at least 20 seconds and looking at least 20 meters, 20 feet away from your computer to relax your eyes, do some stretches, maybe do a walk around the downstairs, maybe do a quick run upstairs, downstairs, whatever, just get moving. Do that every 20 minutes to try and relax your muscles, change your position, and reduce the fatigue that can be associated with sitting in front of a computer all day long. Our prevention efforts. We have our officers out there. Not only are we doing the closure orders, we are also out there doing active inspections related to COVID-19. I also have my team of consultants doing virtual conversations with employers to help them through COVID-19 safety plans and any challenges they might be faced with. As I said, the officer is going to expect that you've gone through the 6 steps. They're going to expect you've done your due diligence. And if you have, it's probably not going to be an issue. If you haven't, then orders may be written. And the order really is meant to be educational for the employer and give you an opportunity. You'll have some time to be able to, depending on what the order is and what the seriousness of it is, you'll have some time to be able to put protocols in place. But it is important that you understand those orders are a requirement for the employers to comply with related to COVID-19. So we've got some resources linked here that can be helpful for you related to that piece. And this just gives you an idea of some of the numbers that we've seen. So these are a couple weeks old, April 23rd. As of April 23rd, we've done over 26,000 inspections. and over almost 5,000 consultations, and we've written just under 3,000 orders so far, and it breaks it down by industry sector there for you to be able to take a look at. Also interesting, I think this is really valuable for employers, is we're starting to do a lot of analysis on the orders that we're writing and where we're seeing the issues. And this breaks down for you where we're seeing most of those issues. And I draw your attention to the 48% policy, practices, and protocols, that almost half of the orders that are being written are written as a result of the employer not having documented policies, practices, and protocols in place. And it is important under step 3 of that COVID safety plan that you are documenting your plan. That is a really important piece. So this will hopefully give you some information on where we're seeing those issues. You know, I look at the next highest, which is the physical distancing, 12%, where our officers are going in and seeing that there's no physical distancing between workers, or lack of, and they're writing orders as a result of that. As you know, there's no barriers in place, no mask being worn, whatever that might be, but that physical distancing becomes an issue. So this is this kind of gives a little bit of a breakdown. I'm not going to go through everything on this slide. Again, you'll have access to the information. But then I thought this would be interesting too, as we started to break this down as well by industry sectors. And I've just got a couple examples here. Food processing. We've written 102 orders related to food processing. And you'll see on the left-hand side that the top 3 orders are related to physical distancing, signage, and facility-based issues of not having the right sanitation products in place or whatever that might be. We've done the same for industrial manufacturing inspections, 453 orders written. Policies, practices, and protocols, number 1. Facility-based, which I just spoke about, number 2. Signage, number 3. We then look at restaurants, a little bit different, 150 orders written. Policies and practices still come to the top, as we've seen for, as I said, half of the orders being written, but then it gets mostly into physical distancing, and supervision and monitoring are the main orders that we've been writing there. So again, lots of information on these slides that you'll have access to through the slide deck. Now, I mentioned if you've got questions, if you're not quite sure how to deal with a certain issue related to COVID, give us a call. 2 phone numbers down at the bottom there. Lower Mainland is going to be obviously applicable to most of you. Give us a call. We've got officers on the other end of the line, answering the phone calls within 30 seconds, answering the questions fully within, on average, about an hour to an hour and a half. Don't fear, don't have fear in calling us. We are here to help with COVID. This is a concern for everyone. We are really trying to help be able to get through the challenges that employers are faced with. Workers can call us, the general public can call us, anyone can call us with questions that might come up. So I do encourage you to give us a call. From a claims perspective, this just gives you a breakdown of the claims. If I draw your attention to the bottom right-hand corner, just under 5,000 claims so far. This is again as of April 23rd, have been submitted. The first column right at the bottom, that shows how many have been accepted. So just over 3,000 have been accepted, and 2/3 of those have been in healthcare and social services. No big surprise. But that just gives you an idea of where we're seeing the claims related to COVID. If you have questions about claims, we do encourage, obviously, that if workers think they might have contracted COVID within the workplace, they do give us a call and submit a claim, and we'll go through that process. If you've got information or questions around COVID claims, there's a phone number and links to information down below on this slide. And looking ahead, remaining vigilant. So just a couple slides left here. Remaining vigilant as conditions change. I've talked about this before. Staying up to date on your COVID safety plan, staying up to date on the orders and notices and guidance on the Provincial Health Office website, and keeping pace with the changes in the workplace. So continuously doing that risk assessment, that plan, do, check, act approach. Can't emphasize that enough as we go through COVID. Regular review is very important through this process. Vaccinations in the workplace. Lots of questions coming our way around whether or not vaccinations are going to be made mandatory in the workplace. We're not necessarily weighing in on that. That's kind of outside of WorkSafeBC's scope. That's more so around labor law and human rights, and really where the Provincial Health Office decides to go with that. They have not made it mandatory at this point in time. But WorkSafeBC, of course, encourages and supports the plan that's being put in place at the employer level. So we do encourage you to be assisting your workers in getting their vaccine, and encouraging, obviously, all workers to be doing that when it's their time within the plan. And then, as I mentioned, under step 6 of the COVID safety plan, just ensuring that you're continuing to pay attention to other risks. Now, the one great thing about that COVID safety plan is it is a really great basis for any health and safety issue. You could replace COVID and replace it with any other risk in the workplace. And that 6-step process, really the first 5 steps, will walk you through how to deal with other risks in the workplace. So I do encourage you, if you're struggling with other risks in the workplace and how to deal with that, that you utilize that COVID safety plan as a way of walking through that process, doing your risk assessment, putting in control measures, having documentation in place, communicating supervision and training, and then your plan, do, check, act approach. And lastly, a few other resources outside of WorkSafeBC. So you got the BC Centre for Disease Control linked here, Health Link, the BC Ministry of Health, health authorities. We've also got lots of health and safety associations that I would encourage you to take a look at if you're a member of one of them. Industry and employer associations like the Burnaby Board of Trade, labor organizations, Small Business BC has some excellent resources available related to COVID. And then federally, there's the Canadian Centre for Occupational Health and Safety, which isn't obviously specific to BC, but they've got some great resources as well. So that brings me to the end. I've got 2 email addresses linked here. Mine is the first. You are welcome to send me any questions after today about what I've presented. I can tell you my response rate is not 30 seconds, but I will get back to you as soon as I can. But I do encourage you to call our prevention information line if you have questions about your COVID safety plan and what to do in your situation. If I get a question along those lines, I will likely forward you to that group anyways, because they are best situated to be able to respond to those questions. I've also included our consultation services at worksafebc.com email address, mostly geared towards industry associations, but you're welcome to send us, that's our general inbox for my team. You're welcome to send us a note there as well. So with that, I am going to stop sharing my screen and we can open it up for any questions that, that the folks might have.
Thanks very much, Chris. Great job there. A huge amount of information covered, and thanks for doing that. There's a lot of great stuff there. Can I kick off? We have got some questions that came in, but I wanted to kick off, if I can, with when referring back to one of the slides that was talking about the employer's responsibility for an employee who's working from home in terms of their workplace safety and their environment. And as you said, on the one hand, you can't really go and do an inspection, but on the other hand, you're going to be responsible. Could you perhaps expand a little bit on, are there very clear lines drawn between where the employer's responsibilities begin and end, or is it one of those areas where there's a lot of gray?
There is a lot of gray. I'm noticing my video doesn't seem to be working here. Am I frozen on your end? Can you hear me?
Yeah, and I can see you. Yeah.
Oh, you can. Okay. Okay. Maybe it's just frozen on my side then. No big deal. So yeah, good question, Paul. I mean, there is some gray in there for sure, but really what it's going to come down to is when the worker is doing workplace related activities related to their job tasks, there is a responsibility for the employer to ensure their health and safety. So, when they get up in the morning and they're coming down the stairs, if they trip down the stairs, that's not necessarily the employer's responsibility, because you could argue that's their commute to work, just to kind of say it that way. And that commute is not the responsibility of the employer. And same with break times when, they're going to get a cup of coffee or they're going to get some lunch. There's going to be a lot of gray in sort of those areas. But if the worker is at home doing work-related activities at the point of any sort of injury or incident that occurs, then that's where the responsibilities of the employer are going to come into play. And so really what you need to think about from an employer perspective is what are all of those potential risks in the home environment, and that you have had that conversation and you've put protocols in place for that worker. So again, the majority of those issues are going to be related to sitting in front of a computer. So you want to work with your workers to have that set up as best as possible. But there might be others. Again, there might be medical related issues that they need to think about. I had a question come up in a session last week around domestic violence, domestic abuse. If that becomes a risk that the employer needs to pay attention to. Obviously, there's a lot of sensitivities there, but if your worker is potentially exposed to domestic abuse issues in the home environment, then it's possible you might need to look, as an employer, you might need to look at an alternative for that particular employee not working in the home environment and getting them possibly back into the workplace. So, there's no black and white answers to what each situation's response or control measure will look like. But these are the types of risks that you as an employer need to think about when you have your workers doing work-related activities out of the home environment. Hopefully that helps.
Yeah, I think it does. And I'm assuming there's no difference between if an employer is requiring the employee to work from home or if the employee has just said, I'm not keen on coming back to the office, I'd rather work from home. That doesn't affect the responsibilities.
No, that doesn't actually change things at all. No, I mean, obviously it's the employer has the authority to make the decision on whether or not their workers are going to be able to work from home. So if the employer says, hey, I need you working from home, or if your worker comes forward and says, hey, I'd really like to work from home, is that a possibility? If the employer allows it to happen, then it's the employer's responsibility to ensure the health and safety. It doesn't matter what initiated the working from home, if that makes sense.
Yeah, it does. It does. Thank you. I'll get into the questions now, and I'll do them in the order they came. And if they seem to overlap, then we'll try to merge them together if possible. No what help, if any, does WorkSafeBC provide to businesses that have received a 10-day closure order to help them reopen safely?
So good question. I mean, as I said in those 3 steps, after that order has been issued, or during the closure order, the officer is going to be encouraging the employer to go through their COVID safety plan and see if it needs to be updated in any way. It is quite possible, like even with the best COVID safety plans out there, there is still a possibility of transmission in the workplace. It is there, I don't think there's any belief that we can completely reduce that transmission within the workplace. So, we would encourage that if employers are going through their COVID safety plan as a result of that, and they're looking at it, they're saying, I really think this is robust, I don't see what I could change in it, then you're probably okay. But if you have questions, give us a call and we will offer that assistance during that period of time. Absolutely. It doesn't mean you're going to be able to open up any sooner. My understanding is that 10-day closure order, that 10 days or more, which has been issued by the medical health officer, that's their decision. They're probably not going to change that. And if you want to ask that question, you need to go to the medical health officer and ask whether or not you can have that length of time changed. But at the point of opening back up, as I mentioned, after the employers open back up, an officer is going to come out and do that inspection. That's also an opportunity for you to ask questions. Yes, they may write you an order, but the officer in the majority of cases, the vast majority of cases, they're not going to turn around and close it down again. But they might see some gaps within your COVID safety plan that you need to address at that point in time, because they will review your COVID safety plan at that point. So that's also an opportunity for you to be able to ask questions. Is there something that you could be doing differently or better in that situation? And if an order is written, then again, utilize that officer to be able to dig in on that a little bit more and see what else could be done. But yes, WorkSafeBC is here to help as much as we can. It's not necessarily going to avoid the closure order because that's not our decision, but we can definitely help with any questions that might come up from the employer. Okay,
thank you. Thanks. Just a question on the process that leads you to go and inspect somewhere. Are you finding a lot of it is, for example, if it's a customer facing or a hospitality or a retail setting, are you finding you're getting a lot of people, calling you to say, hey, I was just in this store, I was just in this place of business here and I saw something? Is that a big source of leading to inspections?
It is one of the sources. I mean, we have a responsibility as the regulator in this province to respond to issues that come forward to our organization. So we respond to every single inquiry that comes in, and we get lots of them. I mean, I think last count were over 30,000 inquiries have come in to our prevention information line related specifically to COVID since the pandemic started. We have a responsibility to respond to those. Now, in a lot of cases, in the majority of cases, it's a phone call out to the employer. Like, for example, if the issue came in from the public or the worker, it's a phone call out to that employer, ask a couple of questions, issues probably resolved, no big deal. But sometimes that will result in what we call an action request. And that action request will have an officer actually go out to the employer and we'll do an inspection. So it really depends on the situation. So that is one trigger. But we have also been working very closely with all of the health authorities in the province to look at where we're seeing trends of transmission in workplaces. I mentioned a few when I was looking at showing the stats there around orders we've written in manufacturing, food processing, restaurants, where you're seeing a lot of the news media or possibly the announcements from the provincial office speaking to certain industries. So when we target our inspections, we're also utilizing that knowledge and that data to say, okay, we're seeing a lot of outbreaks in manufacturing. let's go out and do some inspections in manufacturing. Or we've seen this order recently come out in restaurants about no in dining occurring within restaurants. We should probably go and touch base with restaurants if that's where we're seeing transmission. So we try and use a proactive approach as best as we can, based on the knowledge that we have, but there is also the reactive component through questions coming in our prevention information line.
And are you finding that the overall work for your staff has gone up and you've had to staff up to cope with that? Or is it just that everything is now more COVID than anything else?
Yeah, you know, we haven't really had the opportunity to staff up, so to speak. I mean, we're sort of in an ongoing recruiting phase, particularly with our officers. We have 350 officers, and there's usually a group of vacancies at all times. So we're always recruiting officers. So it's not really that we've staffed up. What I would say, though, is we have had to put some other initiatives on hold that we may have had our teams focusing on, and either completely put it off to the side or reduce our efforts within those initiatives to be able to create the space for COVID. COVID is our priority right now. Every inspection that we do, even if that inspection isn't COVID related, if we're going out and doing an inspection within a construction site related to our construction high-risk strategy, because we have high-risk strategies and industry initiatives, within that construction high-risk strategy, we start every inspection with a COVID conversation before we actually start talking about fall protection or whatever that topic might be. So, excuse me, we've had to cut back a little bit on some of those initiatives and make COVID a priority. And I would say overall work volume, you know, it's been consistently high over the last year in trying to deal with that. And we're going to continue to provide as much support as we can for this issue until we're at a place where, you know, we've got the herd immunity through vaccination, and we can start to see some of those orders beginning to lift.
Right. Okay. Thanks for that, Chris. I'm going to combine the next couple of questions, and hopefully that'll get us to the last question that's just come in as well. So combining a couple here, we're hearing that medical and scientific opinion seems to be moving towards a thought that surface transmission of COVID is extremely rare. Is that having an impact on how WorkSafe is placing the importance on cleaning and sanitizing in the workplace? And I guess that to share it with the next question, which was really, you know, when you look at the basics that most businesses would have in place, you'd imagine that's going to make workplace transmission quite rare. Are you hearing any stories or anecdotes or examples of how that transmission is happening?
Yeah, it's an excellent question, and you're right on the money with the, I think the assumptions and the thoughts that are coming forward in those two questions is that surface transmission is a fairly low risk from what we are seeing, not necessarily seeing ourselves, but through our public health contacts and the conversations that are happening, the research that's happening within our jurisdiction, outside of our jurisdiction. That surface contact, I think, is becoming less and less of a focus area or a concern for us as we go forward. And Dr. Henry has spoken about this as well, that really it is that face-to-face contact with other people and the droplets physically coming out of your mouth and nose that will result in the majority of that transmission. It doesn't mean that cleaning and disinfecting shouldn't be a part of those protocols. We haven't come away from encouraging a robust cleaning and hygiene protocol within workplaces, and I would even suggest that might be one of those things that we see should be sticking around within workplaces. Is that cleaning and hygiene that happens on surfaces. So if you've got certain surfaces that might be touched on a very frequent basis by multiple people throughout the day, like a door handle, like we do know that the virus can survive longer on certain surfaces than others based on the research that's out there. You know, but if you have certain surfaces that are touched very frequently by multiple people throughout the day, it is possible the virus could start to build up, and that's where you can get some surface transmission. But really, your focus area as an employer should be on where people are congregating to avoid that face-to-face interaction, that close proximity of people together, and less so when we come out and do the inspections. We're less so concerned about the surface contact as a mode of transmission as we are about others. It doesn't mean it shouldn't be paid attention to, but yeah, I think what you're hearing is correct.
Thanks a lot, Chris. And galloping on to the last couple of minutes here, and picking up actually from a point that you just made about the focus on people getting together, and a question that came in is, if workers, excuse me, if workers want to eat lunch together, can they eat at the same table with a plexiglass divider?
Yeah, I mean, I need to be careful on, every situation is different, so I need to be careful on what I say yes to and not. You know, you would want to ensure that, and you'll notice on one of those slides, I actually had a link to designing barriers. I would encourage you to take a look at that and make sure that your barriers have been designed appropriately to minimize transmission. But if that barrier has been designed appropriately, then yes, that could be a situation where you could have people sitting at the same table eating with a plexiglass barrier in between, if it's been done correctly. So yeah, I mean, those types of things are situations where every employer is going to need to consider the particular environment they are working in. I mean, that situation gets even better if you're outside as opposed to inside, because we know inside transmission is worse than outside. If you're inside, your risk is going to be higher than if you're outside. So if you're at a picnic table outside, you know, that plexiglass barrier, you might not even necessarily need it, depending on the size of the table and how far apart people could sit from each other. Whereas inside, you might want that in place. So again, these are all factors that employers would need to consider as they're putting that together.
Thanks, Chris. And I guess for that question and the others that we asked today, and encouraging everybody who's attending here, if you have any questions, as Chris just said, each situation can be different and would require a different set of measures to be put in place. So please make sure you contact Chris or the officers whose details he gave earlier. Contact us, contact Corey at our office, corey@bbot.ca, if you have any questions on anything else that you need to know about the COVID programs that we're putting together and restrictions that might affect businesses, and we'll connect you with WorkSafeBC as and when is the appropriate thing to do there. So so thanks again, Chris. That was great. Some really good information that was shared there. Really important that we do everything we can to keep businesses open, and we're glad that so many of you joined us today to find out how you can keep your businesses open.